Welcome everyone to our December UPCA webinar. I'm excited to see so many people attending today because this is really, really great information. And I'm really excited that I remembered to hit the record button before I started talking. That's it's a really big step for me. So congratulations me. I've got some reminders for us before we get started. I wanted to put a plug in for the Bryce Canyon Coalition Summit that's going to be held June 12th through the 14th at Ruby's Inn in Bryce Canyon. The planning committee is already meeting for that, and we're super excited. So um, look for more information to come in the next few months. But I know that Taylor, the chair of that planning committee, is really excited to get that information out as soon as possible so people have plenty of time to plan and request attending through their agencies. So it should be a lot of fun and really great information. Also, I wanted to put a plug in for the Winter Summit, February 22nd and 23rd in Ogden. Also, should be a really great training opportunity. Um, excuse me, more information to come on that one as well. And then I wanted to put a plug in for our UPCA Executive Board. As you know, our UPCA is made up like any of your coalitions. We have a chair and a vice chair and many different board members that help guide us through the process of um, leading the UPCA. And we've got some vacancies that are going to be coming up. So Taylor is currently filling our secretary position, and her term is almost up. So we're going to be sending out a call for nominations for that position, and we'll also send out the roles and responsibilities descriptions for these positions. But and then we also have a position coming available for the funding chair, so someone to help us help find funding opportunities for coalitions, whether that be local, state, national grants. Um, so we'll send this information out today, and if you know anyone that would do a good job and you'd like to nominate them, we would love that. Or if you yourself would like to volunteer, we'd love to have you as part of the UPCA. So look for that today. Before I turn the time over to our awesome presenters, I wanted to share a few minutes with Shannon Bussey, who's going to be sharing some information with us about a project that they are working on for the Winter Summit. So Shannon, I'll hand it over to you.
Thank you so much. I'll just be really brief. I know everybody really wants to hear about the topic today. So at the Winter Summit, we are going to set up a station for photography and videography. And our goal in this is to really gather some engaging stories that can be used to help prevention initiatives and marketing all over the state. And so what we need from you guys is for you to really think about who among the key leaders in your coalitions has just a fun personality, has some great stories, has a perspective that will really be helpful for those efforts, so that we can take photos and we can interview them and pull out those stories and then get the videos. And then we will make these assets available for everybody to use. But if any of you have questions about this, or you have nominations, for people, key leaders that you want to put in for those slots, please email me. My email is shannonb@dbhutah.org. And we are so excited about this project.
Thank you, Shannon. Will you put your email address in the chat when you have a moment as well? That sounds amazing. I'm really excited about that project. Okay, well, without any further ado, let me turn the time over to our awesome presenters. I know you guys are so excited to learn more about how to apply for a drug-free communities grant, and our two presenters are some of the greatest resources we have in the state to share this information with us. So we've got Melissa Vader, who is one of the prevention coordinators here at Southwest Prevention, and has been writing DFC grants for probably 10 years, right, Melissa? And then we've got Madeline Robles, and she is a prevention specialist and a coalition coordinator up at Weber CTC, and has also had lots of experience working with the DFC grant, implementing the grant, writing for the grant. So really great sources of information, and I'm so excited to hear from them. So without further ado, let me turn the time over to Melissa and Maddie. Thank you guys so much for being here.
Thanks, Heidi. I'm really excited because this is one of my favorite things to do Well, let me preface this. I don't like to grant write, but I love like looking at data and putting it into action and seeing the great outcomes, which I've been able to do with some of the coalitions that I've worked with through this grant in particular. So I'm not very good with technology. Something's kind of going on with my computer. So I can only see my slides and not your faces. So if you're raising your hand or have a question, I can't see that. If you'll just shout out a question while I'm talking, that's okay. And also, if you guys will all make sure you mute yourselves when you're not talking or asking a question, just so that everybody can hear the information. So everybody can see my slides? Yes? I can't see your faces. Somebody
Yeah,
say yes.
we can see them.
Okay, perfect. All right, so prepping for a drug-free communities grant. If you don't know what drug-free communities is, it's a grant. It comes from the federal government. It actually comes down from the White House. And the application generally comes out in the first of the year. You have a couple months to prepare the application and submit it. There are a lot of things that we can be doing now to prep. And so this is kind of what this webinar is. It's also the same presentation we did back at Fall Conference. There are things that we can be doing now to get ready before the application comes out. So that's kind of what this is to introduce what it is. If you're unfamiliar, what are the things that you can do now to get ready for the application? So when it comes out, it's really just plugging in the pieces that you've done. But a lot of this, when we go through and we're talking about like collecting data and line logic, a lot of us should already be doing this anyways. And doing these, collecting the data, doing your assessments, planning implementation, the whole SPIF process is for any grant. So not just drug-free communities grants. So, so really kind of the objectives of today is learn what we can do to prepare now before the notice of funding is released. How do we prepare that action plan that includes all 7 strategies for community change, and that we're following the SPIF process. Maddie's going to talk about how to prepare a budget, how to locate and fill out the required attachments for federal funding, and any kind of other grant writing tips, like I said, is good for any of the tips we have today is good for most grant writing at any level. So for those unfamiliar, the DFC, it can provide up to $125 each year for 5 years to a community coalition who meets the eligibility requirements, we'll talk about later today. You can get a first 5-year cycle, and then you can reapply for another 5-year cycle for a total of 10 years of each year of $125,000. So it's a great opportunity. It is a lot of work, but I'll tell you, it's so worth it. So the 2 goals of the Drug-Free Communities program is to establish and strengthen your coalition that you already have. So including all of the sectors, which we'll talk a little bit about today if you're unfamiliar with that. And also your second goal is reduce substance abuse among youth. So over time, we're eliminating that from adults. So following the risk and protective factor models. So kind of why this came about was a lot of times because I have been writing for a lot of years, I've had 4 of my own applications awarded. I've helped many others who have been awarded. And I also have helped many others who maybe didn't quite have things ready and were either their applications were thrown out or they weren't awarded because of our ducks weren't in a row. And also a lot of times when people call me and they want some help, it's like, oh, there's no way we can throw together this application in this amount of time. So what can we do now? Let's get our ducks in a row. So here we go. So what are things that we can do now? So some of the things that we can do now is a community assessment. So getting your community readiness surveys, getting your SHARP survey, looking over that. What are our priority focuses? Collecting data from juvenile probation, doing listening sessions with your coalition or other community members, doing parent surveys. And this should all be a part of what you're doing with your coalition already. If you're not, this is something you can start now. Let's start trying to pinpoint what our problems in our communities are. Then you're putting together your logic model, right? So what is our problem? What is the root cause? Like, why is that the problem? And what is the local condition? So why in your community specifically is this a problem? Why is underage drinking a problem? I oversee probably 8 different communities, and underage drinking might be a priority focus. And some of the root causes are the same, but the local conditions are different because the reasons why kids are drinking in that community is completely different from a neighboring community. So it has to be really tailored to your community specifically, and you find that out by doing your community assessment. Then right now you can prepare and write an action plan based on your data. And so we'll talk a little bit more about that later. So you can also get that ready now. Another couple of important things is you need to secure a lead agency or a fiscal agent, and then have them start creating the mandatory accounts that they need to become a fiscal agent. So they'll need to have a grants.gov account and a SAM account. If you find an agency who already accepts federal funding and is accepting federal grants right now, both these accounts should be created. You just want to make sure that they're up to date. A couple of things when you're looking for a lead agency, they can't already house a DFC. Only one agency or nonprofit can house one DFC at a time. And you want to make sure it's somebody you have a really good partnership with and there's longevity. So one of the coalitions that I worked with was a nonprofit who we had been in partnership with almost 7 years of our grant, and closed their doors in 2 weeks. And then we actually had no access to our grants, and it took us almost a whole year to get things figured out. So I really highly recommend partnerships with cities or counties or kind of those governments that you have good relationships with, that you can have as that fiscal agent or the lead agency of your grant. Also, you can prepare a project narrative, and it's based on your community assessment. So we'll talk a little bit more about what are the questions in a community assessment. And also, Maddie will talk more about the budget. She'll explain more about match, what you can consider match, what you can't. And then also you can collect CIAs, which is a coalition involvement agreement. One thing I want to mention is everything that I'm talking about today is based off of last year's application. Applications change year to year. Most of these types of things stay the same with very little change, but sometimes they will make some small adaptations or small changes, but this is basically what they need to know. So you can start these things without having the application right now. One of my things that I always suggest, read the whole notice of funding opportunity or the NOFO first, because you want to make sure that you're eligible and that this is something that you're ready to do. Is it possible? Can I do this? And that there's no surprises in the end. So when I talk about some of my coalitions I've worked with, or people that I've worked with in their coalitions, and they get to a certain point, we put in all this work, and then there was a surprise, and they're like, oh, I didn't know that, or oh, there's no way. One of my coalitions didn't realize they needed a lot of this documentation from the fiscal agent, and it was within hours of submitting over a weekend, and it was just really hard to obtain that, and some can't get that from their fiscal agent on a Saturday at like 9 o'clock at night. So read through the whole thing. I like to highlight. I print it off. Some people are like, well, I'm good without printing it off. I'm a digital person. I like to print it off. I like to read it. I like to make notes. I like to highlight. And so please take the time to do that before you even start any of this other work. Well, you probably have already started it, but you know what I mean. So let's talk about what are the eligibility requirements. As of last year, it is a requirement to be a coalition for 6 months in existence, and how you document that is by coalition meeting minutes. And so it can be very detailed what they want in those meeting minutes. There'll be a specific timeline that those meeting minutes come from. They want to know what subcommittees you have, what are the projects and activities. They want to know who attended those meetings and what is their role, what sector do they represent. You want to just, whatever meeting minutes you pick, you want to make sure that they show a really good showing of what your coalition is doing. So find a meeting where you're talking about different topics, where lots of people are represented. And I don't want to say like, don't be honest, but really just sometimes if you have to go back and soup them up a little bit and add a little more detail, that's fine. But not saying being dishonest, if you know what I mean, but just select a really good meeting within that time frame. You have to have a mission statement, and that mission statement has to require the reduction of substance use in youth. So if you need to go back and just adjust that a little bit in a coalition meeting where you add that, Your mission statement probably should include something like that anyways, kind of in our line of work that we're in. So it does have to include the reduction of substance abuse in youth. And the other requirement is you have to name at least 2 drugs that you are addressing in your 12-month action plan. And so we know like drug or alcohol, tobacco, marijuana, cocaine, whatever that is in your that you're working on your priority focus is what we're talking about. One thing that I did notice in last year's application that has been different in the past is vaping is not a substance. It is a delivery method. So you want to make sure you're talking about tobacco as the substance, but you might addressing the delivery method of vaping. So make sure you're wording that correctly in your application. Small little things like that can get you screened out or knocked down on points where you could be at risk of not being awarded. A couple other eligibility requirements is 2 DFC coalitions may not serve the same zip code unless the coalitions have clearly described in their plan how they're collaborating together. So for an example, here in Garfield County, Panguitch Coalition was first. They included Bryce Canyon, Ruby's Inn area zip code in their first application because a lot of people from Panguitch work out there. So they wanted to be able to do prevention strategies. However, when Bryce Valley Coalition was formed and started and wrote their application, now there was the 2 zip codes. So all they had to do was just write a letter that they both are aware that they exist. And these are some of the things that we're collaborating on together. And it was just a short little paragraph statement. If there isn't 2 if you're not 2 DFCs over a zip code, then you just have to usually just submit something that says there's no 2 zip codes or 2 coalitions applying for DFC funds in the same zip code. The reason for that is you should know your area and what's happening. And so, and working with those other entities in your area. So you cannot have more than 10 years of DFC funding. It's 10 years of funding, which is awesome. So that first 5 years and the second 5 years, and then after that. So a lot of the drug-free community grant is trying to build that sustainability in your community. The purpose is after the 10 years, you've built all of these relationships and you've created that sustainability that hopefully you don't need any more federal funding. And so, but yes, you can only be eligible for 10 years. You have to pick an entity that is eligible to receive federal funding. So they need to, the fiscal agent or the coalition has to have that 501c3 status. And you'll have to show some documentation to prove that, like a tax exempt ID and some different things like that. And then also, again, a fiscal agent can only be a grantee of a DFC award for one. Sorry, that came out so wrong. I think I said it earlier. Only 1 DFC per fiscal agent or organization. A couple of things is you need to have key personnel, and this is part of your fiscal agent, kind of that responsibility of the fiscal agent. So you'll have that authorized organization representative, which is generally your finance representative. So they have to be, again, you can see in the bolded, the representative is charged with the financial oversight and responsibility of the DFC award and must be an employee of the organization. So for an example, if you are going through your county as a fiscal agent, then the AOR and financial person has to be the financial person of the county. And then the next one is the project director or principal investigator. So this is the person who's offering that oversight and is accountable for what is going on with the grant, with your action plan, basically. And this also must be an employee of the application recipient organization, so your fiscal agent. It cannot be the same person as the AOR. So one person has to be the financial person. Usually it's the director or like a county commissioner that's been assigned or something like that. And your project coordinator is the person who's doing all the work, all the hands on deck, doing the monthly meetings. And this also can be the program director. So the project coordinator, program director can be the same person. This grant can fund partial or these positions. But one thing I like to say, I went to when I very first was awarded my grant almost 10 years ago when I went, I was talking to some of them, other awardees, what they spent their money on. And a lot of their money was going into personnel. So to fund some of these positions. And then they had very little to spend on implementation, where I was exactly the opposite. We only funded a partial position and everything else went into implementation. I feel like that's how you're going to make the change and have the outcomes, right? So, but there, you can write for that personnel cost in your grant. If there's any questions, again, speak out because I can't see any of your faces or raised hands. A couple other things of requirements is you have to have a way to collect data. So they call it the cross-site evaluation. So the couple of starred things are you have to collect 30-day use, you have to collect perception of risk, you have to collect perception of parental disapproval, and perception of peer disapproval. So your SHARP survey, and you have to collect it every 2 years in grades 6 through 12. So SHARP survey covers this. If you don't have SHARP survey, there's a couple other smaller options, but it really is SHARP fits this. So, so another requirement is you have to have all 12 sectors represented. So a sector is, that agency, that organization. So you have to have a youth, has to be somebody 18 years or younger. Typically, I feel like it comes from your youth coalition. There has to be a parent who's actually individually legally responsible for a child. So through all of these, there are some certain criteria that they have to meet. So there's business, there's media, there's school. So you can't just select somebody and say, oh, this is our school representative. It has to be somebody who has influence in the school policy or procedure in the school system. So if you look through these, and again, when the application comes out, sometimes these things change just a little bit. One of the newer things that I've seen over the last couple of years, like with law enforcement, it cannot be a retired law enforcement officer. They have to actually be a representative who's sworn in law enforcement. So that was something that's changed over the years. And the healthcare organization, it has to be somebody who's licensed to provide physical, mental, or behavioral health services. So it can't just be somebody from the healthcare services, like their front desk manager or something. So there are particular stipulations required even within finding somebody in that sector. So just make sure you read through those carefully and that you find the person that fits it well. You only have to have one per sector. You might have several on your coalition, and that's okay, but just for the requirements of the grant, you just have to submit the CIA. We talked about that coalition involvement agreement for one in each sector. This is just kind of what it looks like in the application to register for those systems that we talked about. So the SAM account and the grants.gov. If you go to an old application or last year's, and you can find these links in the instructions if you want to do that now, before the application comes out. Sometimes it can take, and if you wait till the application's out, do it week 1, it can take weeks. And I've actually had people on the day of submission before the grant closes that are still waiting for their accounts to be approved. And we've been on the phone, like begging, like, please go find this. So we put all this work. So it's one of those things, like trial and error for me with working with different people. Start it now or do it the first week. Don't wait too long if those accounts aren't created. So a project narrative is basically you're talking about the history of your coalition. What's the background? What's the history? Talk more about your assessment data. Why is substance use a problem in your community? You're explaining to somebody who doesn't know anything about your community why substance use is a problem. And how did the coalition come in existence? Are you a CTC coalition? Have you had any particular trainings about the SPIF process, like anything like that can tell the person who is reading this that, like, hey, this is our history, this is our problem, and we are prepared to receive funding and put it into place and do a good job with it to have outcomes. You have to have an approach. So what is the purpose? What are your target populations? Is it students? Is it parents? What are the health disparities? What are the collaborations that you have in those partnerships? What are the outcomes that you hope to see? And then you'll do your strategies and activities in your action plan, which we'll talk about in a second. You also have to have an evaluation or performance measure. So this is just how are you collecting data on your implementation? what surveys, questionnaires, any kind of reporting that you're doing. If you contact Bach Harrison, they can assign somebody to your coalition to help you actually even in the writing application process. But you can't contact them 2 days before you want to submit. I would contact them now and let them know you're interested in writing an application and have somebody assigned. And as soon as your action plan is written, they can look over that and kind of help guide you on how are you going to collect data on these different implementation strategies and activities. Organizational capacity of application to implement. So how are these key program partners going to participate in your coalition? So talking about the partnerships that you have, and then a work plan, or AKA your action plan. So those are things all included in your project narrative. If you go back up to the top in parentheses, that there's very specific instructions. So you can only have 20 pages, has to be single space, 12-point font, 1-inch margins, number all your pages. And this is included in the work plan. So your action plan has to be included in that 20 pages. This used to be like 30 pages long. Basically what they were telling us is no fluff, just put the basics, keep it simple. They're reviewing hundreds of applications. So they've narrowed it down. I have been actually Heidi's coalition, the first year we helped her in Iron County. I was reviewing her application. I was helping her submit it. Her margins were wrong. So I went and changed, made sure everything was 12.1-inch margins. But when we had been writing together, it met that maximum 20 pages. However, when I went and changed to 1-inch margins, it pushed it 2 lines onto the 21st page, which we didn't catch, and we were screened out. So it's very, very particular. Just please follow the instructions. That's why it's very important to read the whole NOFO from the beginning and make sure you're really just double checking and following what they say. So in a background, that's going to, like I said, include the history of your coalition. How did the coalition come about? How does it contribute to lowering or to use rates, community assessments? How are you collecting data on those 4 core measures? Mention other data collection methods, like I mentioned, focus groups, parent surveys, community readiness, DUI rates. What are the risk and protective factors in your community? What are the, and help explain more and why those, why have you identified this as a problem, and why is it the root cause, and what is the local condition, and explain to them why. The current youth substance abuse problems, and elaborate on those. This is why it's a problem. We have youth in our community who work at local convenience stores, and when the older 21 person is not in the room, they sell to their friends and then they join them at the party later. That is legitimately something that was happening in one of the communities I work with. So that's going to be different, and the plan that you put in place is going to be different from another community who might be trying to build strong family bonds because attachment is low. So it really needs to make sure everything, that line logic, ties back. So what's the problem and why here? Again, mention any trainings like CTC, NCA, CADCA, so that they know that, hey, these people really know what they're doing. This coalition is prepared. They're well trained. And any status of prevention staff. If you have maybe some cuts happening, or you could use more prevention staff because your department's growing. Mention things like socioeconomic status. Are you rural? Are you low income? So really, again, just to paint that picture of what is happening in your community and your coalition. In your approach, you want to make sure you're specific, that your action plan is actually addressing what you described in your background, and that you want to talk and you want to share the outcomes that you expect to achieve by the end of the project period. And also, what do you expect to achieve based off your logic model? So our outcomes are the results of the programs we intend to implement. You want to describe the strategies and activities and how that is going to target those outcomes. You want to talk about collaborations. Maybe you have an event or something, we're collaborating with the law enforcement for take back and the pharmacy, and kind of explain in detail how everybody is working together for this effort. And again, your target populations, is it parents? What are the health disparities? Is it low income? What is that? And how specifically your plan is targeting those populations. You again have to have an evaluation or a performance measure. So again, the SHARPS meets this, but also you have to have a data management plan. So I kind of already talked about this, and somebody from Bach Harrison can help you with that. Again, you want to make sure in your action plan, so what you're talking about, everything is in a line. What you're talking about is our problem in our background. What is your root cause, your risk and protective factors? You want to show the data for that. This is getting our ducks in a row. You see my cute little ducks. Right now, we're getting our ducks in a row. What is the local condition? Make sure that you have all of that in place before you start preparing an action plan. You can't start preparing an action plan if you don't know what the problem is. And it needs to be tailored to your own. A lot of people want me to share my grants with them and my action plans. I typically don't, because it needs to be yours. And then from our action, or from that first part of those logic models up to the local condition, now we need to put in our action plan the 7 strategies for community change. So if we go back to our local condition, is little or no opportunities for families to spend time together at little to no cost. So they're a low income area. Their community readiness survey says there's no activities for families to engage in. And so then I come to my 7 strategies, and what of those 7 strategies, use as many as we can to target back to that local condition that also targets back to the risk factor and the problem. So a couple of things, as I get into this next part, this is really, really important. So your action plan needs to be detailed and meet and align with the DFC goals. So those first 2 goals that I read in the beginning, I always just put those on my goals. My goal is collaborate and all those details. And then it also is to reduce substance use. So I just copy and paste. Those are my goals. If that's their goals, those are going to be my goals as well. And then you need to make sure you address 2 substances based on your community needs assessments. We talked about that. Again, vaping is not a substance, it's a delivery method. So make sure you include that in your action plan. Everything needs to be based on data. So we've talked about the data sources. Include activities that address risk and protective factors, including root causes that may be driving the substance use in your community. Use existing frameworks such as the SPIF process or 7 strategies for community change, and includes objectives that are specific, measurable, achievable, realistic, and time bound. So this is a very important part. If you don't take anything else away from today, this is what you want to remember. When you're writing your objectives, they are looking for very specific things in their objectives. So they're looking for, what I have in yellow, indicate the type of change. Are you increasing or decreasing? How much change will occur in the specific amount? We're going to increase family bonding by 5%, or we're going to decrease alcohol by 2%. What is the specific population to be addressed? Is it parents, families, youth, 7th graders? Include a specific date, year, and month that the change will be accomplished by. I usually generally put by an upcoming SHARP survey. So in September 2027, that's when I hope to see some change. It's several years out. We know we're not going to usually see change right away. And indicate how it's measured. So the SHARP survey. And include a good mix of 7 strategies for community change. So you're going to get a little sneak peek of what an action plan of mine looks like and how this plays into those SMART goals. So as you can see, I've highlighted in yellow and the colors that we just talked about. So my goal is to focus on strengthening and changing family home environments by increasing, remember in yellow, and then my population is the family. My percentage is 5%. My data, so baseline data, sorry, that's not included in that, but I always include my baseline data. It's nice and easy reference and that they can see as well. So in 2019, I've included what my baseline data was. And then you can see in gray what my date is. So by September 2023, and how am I measuring that? By my SHARP survey. And then you can see here, here's my strategy. So that's my objective. We're increasing basically family bonding, opportunities for families, pro-social with families in their environment, and parents' ability to speak to their children about substance use. So I'm going to provide information to families and community members on the importance of family bonding monitoring. And then you can see in my activity, I'm going to use the statewide Parents Empowered campaign. That is to provide information. We're setting up booths, we're talking to parents. I'm providing the information. You're going to put down who's going to do that and by when. So the by when isn't as specific, like they're not going to be like, oh my heck, you didn't accomplish this by this date. It's more or less for you to set up a time frame. My second strategy is enhancing skills. I'm going to implement the Guiding Good Choices program. So I'm teaching skills to the parents on how to talk to their kids about substance use. I'm going to provide support to families by bringing everybody together and having these educational family events where the skills we're doing there are specifically focusing on spending time together and social development strategy. I'm going to enhance access or reduce the barriers for parents or families to learn the skills. So I'm going to provide a meal and childcare scholarships to those who come to my classes. I'm also going to offer an incentive for those participating. So participating in the class, so a reward for an attendance. And we're also going to provide a family kit for those who come that helps go home and teach the skills. We're going to change the physical design. So we're going to partner with our schools and our city to have Parents Empowered messaging advertised. And then we're going to modify and change policy. So can you guys see how I used all 7 strategies just for the one objective? And then again, you can see there at the bottom, Maddie will actually put a handout in the chat so you can see how this all plays out. So again, you can see this is, if you're a CTC coalition, you're going through that whole process, getting started, getting organized, develop the community profile, create a plan, implementation, evaluation. SPIF, you're assessing, your capacity building, you're getting everybody involved, you create a plan. How are we going to implement? How are we going to evaluate it? So you can use CADCA model, CTC, you can get Bach Harrison involved. That's all I have for my end. I'm going to turn the time over to Maddie. She's going to talk a little bit more about the budgets and how to locate those required documents on the website.
Melissa, if you'll stop sharing for a minute, I think this will be easier for me to speed-wise go through this with my own stuff. So we'll just do a quick confirmation on, maybe somebody can give me a thumbs up on if this is something you see. Can you see the screen? Okay,
I can see it.
Super cool. Awesome. Well, so I know that we're throwing like tons of information at you because at this point you might be kind of feeling like Charlie, where you're trying to connect all these dots together. You're trying to figure out what you're going to do next. And that can be a little bit overwhelming. And so I want to just take this time to kind of like encourage you to consider if this grant is totally the right fit for you. Especially too, if like right now you're thinking to yourself, like, wow, we might not be ready for this, or wow, we don't have any of our ducks in a row, right? Like this little theme that Melissa has brought up, that's okay. Try and refocus yourself by making sure that the missions are aligned, because this will end up getting easier for you. And all of the overwhelming feelings will kind of probably calm down a little bit when you get to the point where it's like, okay, I'm pretty much just telling these people what we're already doing. I'm just putting it in the format they're requesting that I put it in. So just keep in mind, okay, that like it is totally normal to feel a little bit crazy and a little overwhelmed at this point. So I'm going to go through things a little fast just to make sure that I honor everybody's time. But just know too, we're going to be sharing some handouts in the chat. So we'll make sure that you get all of this and you can access this later and have our contact information and all those things. So I'm going to start off, this is kind of a strange place to start off, but it's really hard for me to have all the other budget conversations if I don't explain what match is first. So match is this kind of, it shows that you have skin in the game. So funders are going to look at this concept of match and saying that you have you have resources that you're putting into this. So you are looking at in-kind support and match, I guess, categories, maybe are like in this acceptable range that they're giving you here. So you're talking about the values of good and services with pro bono services being offered, right? Like somebody comes and does a training for your coalition for free, or somebody offers you office space, or somebody is just volunteering, right? So that's like your youth council, your adults that are volunteering. There's actually criteria you can use, and there's guidelines for how much like to monetize that. So you can say, okay, I've had 200 volunteer hours, so I'm going to monetize that and be able to claim that as match. You can't claim anything that's federal funds. So you'll see in this unacceptable category is that you can't include anything that's funded by federal funds. And so sometimes that gets a little bit dicey to figure out. I can't go into that today, but just understand, like, this is match. This is actually pulled directly from the notice of funding opportunity. So these are just things to spend time pondering. And again, this whole presentation is about trying to have this be something you hear before you look at the notice of funding opportunity so that you know what to look for. So match matters because the DFC requires you to have 100% match. That sounds like a lot. So basically you're going to end up finding $125,000 of matching requirement, but you'll be surprised at how easy some of that thing, how easy it is to find some of these sources of match. You can see the little asterisk I put at the bottom here, though, is that it's way better to underestimate your match than to overestimate. I was actually just talking to my gal that helps manage our DFC grant at my organization yesterday, and we were going over match because we were closing out the grant for the year and reporting on our final spend down. And anyway, we realized that we actually had so much more match just in our volunteer hours than we ever, like, we only claimed that we would get 600 hours of volunteer time, and we had more than 2,000 hours of volunteer time. But you don't want to claim the 2,000 hours because you might not always get that. So if I know I'm going to get 2,000 hours and I feel confident about that, claiming 600 is a very safe bet. So just never set yourself up to fail, as I guess the moral of that. So when we're looking at funding, there's other things that you're going to want to pay attention to in the realm of funding restrictions. So Melissa had kind of already gone through some of these eligibility things. To just reiterate, like, an organization can only have one DFC grant. You can only get 10 years of funding, but there's also program funding restrictions. So you can see they say specifically, you can't do research with this. You can't have clinical care. And then it can only be used for reasonable program purposes. So tell you, like, specifically, hey, you know, generally we can't really have you purchase furniture or equipment. You have to, so to purchase furniture and equipment with this grant in particular, you have to go through extra paperwork to do that, because you have to have basically like a maintenance plan. You have to be like, okay, so I'm going to buy a trailer. How am I going to maintain the trailer and make sure it's registered over time? How is it going to be sustainably funded? Because they don't want to just buy something and then have it like sit there and not be able to be used or not be maintained, things like that. They explicitly tell you, hey, you can't use these funds for lobbying. So that's why sometimes too, when we talk about going to Capitol Hill, I think a lot of us are actually pretty familiar with this because we are either employed by a government organization or a nonprofit, and there's lobbying rules there anyway. But anyway, so those are just things to consider. Melissa brought up multiple times data and evaluation and all of that, working with Bach Harrison. It's important to note you can't use more than 10% of the total federal grant award to pay for data and evaluation. So everybody, Bach Harrison is really well versed in setting up these DFC contracts for data and evaluation, and there's a pretty good system already set up in place. So but know that, like, these are all things that have been defined by this notice of funding opportunity. Another thing that might be interesting to this group, you cannot use these funds for purchasing naloxone or Narcan for constructing anything. So you couldn't use it to like make a building space or anything like that. And these funds cannot be used, at least in the last notice of funding opportunity. Like Melissa mentioned, these things could change. So some of these restrictions could be lifted by this year, but like as of last year, you could not purchase vaping detection devices, fentanyl strips, or drug testing kits with these DFC funds. So there's also a lot of things that they have in terms of like these funding requirements, but they're kind of like highlights, like best practices that they want you to be aware of. The italicized words are me. That's me trying to tell you what they're trying to say here. Our first point, and a lot of points in the notice of funding opportunity, is boiling down to this concept that your fiscal agency really should be involved in your grant. They shouldn't really just be an organization that's like completely hands off. They should know what's going on. And they should know what the money's going towards. You should keep them in the loop for sure. So having that really good relationship, like Melissa talked about earlier, with that agency you choose to partner with is really vital. You also don't really want to have the DFC grant replace another grant. Like you want to be able to use these funds to enhance and expand what you're doing in your communities. So whether that means that you're bringing in another paid staff, right, that's expanding, that's enhancing some of your efforts. It's not necessarily a grant that's meant to replace funds that may have ran out. And then you can't necessarily use this to like give other people money. So you can't necessarily get this money and then pass it off to another organization unless you have like specific things set up. Like obviously you can if you're like hosting a community event and you're like, okay, at this community event, we need somebody to, I don't know, like we need to rent out the space or whatever, right? You can still like, that's not necessarily like you're just paying them for their services, but you can't necessarily with these funds say, okay, when we get these funds, we're going to do a mini grant and then we're going to give the after school program X amount of dollars in these funds to do XYZ. Maybe there's ways you could organize that, but you'd have to make sure it's really well outlined because they might raise some questions if that's in your action plan. And then again, just the people who are involved are really expected to play a real role. So another thing to keep in mind, food usually is not allowable. You can kind of, with some stipulations, if it doesn't exceed $3 per person, you can make that possible. But this isn't a grant that can cover your general coalition or subcommittee meetings, like food or treats or refreshments at those. This isn't the right grant if that's what you're looking to fund. And generally speaking, they say promotional items are unallowable. So that could be what we call swag sometimes. I've found ways to be able to make it more mission focused. So I would just say get creative and make sure everything's mission focused and that you have a reason. Don't just get swag for the sake of getting swag. And sometimes too, if maybe you're just trying to brand your community coalition or you're just trying to raise awareness, there's ways that maybe you can frame this in a different way that I've seen coalitions be able to do. But I highly recommend that you don't try and rely on the words promotional items or swag or any of those types of things. Like those aren't going to go very well in your budget as you go through. So I want to just put a little, like I just gave you an overview of what I pulled out as some of the most important things for you to pay attention to, but they have so much in this notice of funding opportunity. So another thing you should be aware of is that they actually, because this funding opportunity is funded by the Center for Disease Control and Prevention, the CDC. And so the CDC has specific budget preparation guidelines that you can look to. And so I will give you links to look at this document. But just know, like, this is there. They outline all of this for you. You don't have to go into this blind. They will tell you exactly what they want you to do. Your budget narrative is going to have these general categories. And so these are the things that are generally allowable. Again, like equipment, for example, it's more paperwork if you want to do equipment. You're gonna have to do more if that's something you want to write into this grant. This is a funding source that allows for you to claim indirect costs. So that's another thing that if you're working with an agency, like a fiscal agency that requires you to have indirect costs, this grant can be an option for you. And that's something to know as you're trying to set up that partnership. I'm also going to be sharing this. This is like a little snapshot of a piece of my budget for our DFC grant. So you can see that this is the other section. Part of the reason why I included this is to kind of show you different things that when I talked about these budget requirements have lots of really funny things. So you'll see like in my other section, I had to put my travel for CADCA for non-personnel in my other section. Something that is specifically laid out by the CDC. From my experience, they won't necessarily screen you out if you don't follow these things, but they definitely won't give you the money until you resolve them. So you have to go through these budget revisions and whatnot. So it's always better to save ourselves the work in the long run and just say that maybe do it right the first time. They're going to want your travel for non-personnel in your other section, and they're going to want your travel for personnel, which is anybody in your salary and benefits request or match section. They're going to want that in the travel section. So anyway, there's just like a lot of very interesting rules to know, and to know they exist, to have this again be the first time you hear it. So then the second time you hear it, maybe you're a little bit more prepared to understand what we're talking about at this point. So every section that you do, so this is like your other category, you're going to have this, what you're trying to, this is your federal request of what you're trying to request here, a general rate of how you're calculating that, and then the cost. They literally do check that your math lines up. So for this, they're going to look at my per diem request, and they're going to make sure that 74 times 6 times 2 equals $888. They literally take the time to look at those things. And then with each section, you need to provide a justification. So what are you doing? I had to kind of dot this here for you. So obviously this is a lot longer, but tell them why you need these things. Sometimes people put a justification in the actual table itself, but sometimes that gets a little convoluted. So sometimes just writing it as a narrative is a great option for you. And then also in that category, what you're going to want to do is provide what your match is. So another reason I included the other category, so you could see that this is how we're claiming match. I would recommend going and looking at this monetary number. A lot of times these update like per diem rates of what you can claim as a monetary value for an hour donated by a coalition member. So anyway, again, just you include this match section with like right after your federal request. So your category is other, you have your federal request, you're saying this is what we're requesting for the DFC grant to fund. This is the justification for why we need it. In this justification, it's really great to say things like how it's going to enhance or expand the efforts in your community. And then you include a match section of this is our skin in the game. This is what we're contributing to this project. So the DFC isn't paying for any of my volunteers to be involved. They're just there on their own accord, and they're contributing to this work, and my community has skin in the game. So a lot of things too. There's what I call our sneaky requirements. So this is one that really tripped people up, especially when this went to the CDC. CDC has what's called a risk questionnaire. Again, I'm mentioning this now, so this isn't that, that this is the first time maybe you hear it, but then you're prepared and you're asking those questions and saying, oh, you know what? Maddie said on that one webinar one time, there's this thing called risk questionnaire. Let's make sure I go find that. And so the risk questionnaire is basically how risky is it to give you money? And by you, I mean really the fiscal agency. So they're asking things like, hey, do you have a tracking system? Is there a tracking system in place for us to know how you spent this money, and for you to pull a report and be able to say, okay, you gave us $125,000 and this is what we did with it. And you can give them an expense report that says, this is how we spent the money from this date to this date. And anyway, so they're looking for things like that. Do you have a system in place? Have you ever defaulted on anything? Do you have outstanding debts? Have you ever had any problems with receiving federal funding in the past? So those will be all things that are dependent on your fiscal agency, not necessarily your coalition, because most of us don't have 501c3 status. So we basically borrow that from another organization. So anyway, questionnaire applies to the fiscal agency. It's there. Don't forget to do it. Another thing too is that they have this thing, it's this duplication of efforts. And so then it has this randomly here, right? So at the very bottom, it says, applicant must upload the report in grants.gov. Under the other attachment forms, the document should be labeled report on programmatic, budgetary, and commitment overlap. So I don't have time to go into like what exactly this is, but just helping you understand that these are kind of sprinkled throughout the notice of funding opportunity. Know to look for them, know to find and make sure that you're looking, hey, do they still require this same thing as they did last year? Chances are they probably do, but maybe it changes this year. We don't really know yet. So anyway, this is just like another one of those random forms that then all of a sudden it's like, oh wait, I have to do that. So just know, yes, you probably do have to do that. Be prepared for some of these sneaky requirements. Other than that, you can see that in the other information, it does outline, like this is actually pulled directly from the notice of funding opportunity. It outlines, hey, these are the things you need to make sure you upload. It tells you it tells you the naming convention. Upload as a PDF, right? So like these people are very specific. They have a method, they have a way to relieve burden for the people that are reviewing these applications, so that they have a very formalized way to look at this information that you're giving them. So follow all their instructions. When it says name attachment one, sector table, and 12 CIAs, just do that. And just know that they give you the instructions to do that. I'm going to be providing to you this presentation. So these will be hyperlinked. If I have time, I'll probably flash some of these really quick before I come off screen share. But just know there's not really an easy formula for grant writing, right? Like it's gonna look like it's like crazy and all over the place. But once you do this once, a lot of these things can actually really be plugged into other places, right? You can try and have one synthesized action plan, because the reality is you don't necessarily want to just be chasing grant funding to have more work to do. Go after the grants that fit into the work you're already doing. Make an action plan that fits into whatever grant maybe that you want to apply for. And don't give yourself more work. We really want our work to be framed by the action plans that we're building with our community, not to be framed by what grant we have at that current time. Don't let the grants dictate the work that you're doing. I know that that's really hard to necessarily follow, because the funding is what makes it possible for us to do a lot of the work that we do. But just try and save yourself the effort, because I've made the mistake of writing so many grants and giving myself more work. And then we're working from 7 action plans, and some of it's overlapping and some of it's not. But everything we're doing is grant driven by what the funders need, as opposed to what the community is telling us needs to happen. And so it's really worth it if you can try and get all of these things set up, and then see if you can plug what you're already building in your community into grant opportunities that you're like, you know what, this grant opportunity is the perfect opportunity for us. And it makes it so that this grant writing thing gets a little bit easier. We've talked a lot about this thing, the NOFO, the notice of funding opportunity. It's going to be really like, you can read it and then all of a sudden you're going to walk away and be like, wow, I actually don't know if I understood anything that I just read. So that's okay. That's really normal. And so that's why we're kind of offering our help. I know that this is like fast and furious to try and do in an hour, and there's so much information to know. Melissa and I have talked repeatedly that this could be days. We could host these seminars over courses of actual days to help people prepare for this grant. But anyway, it's a lot of stuff. And so ultimately our question to you is, all your ducks, are they in a row? Where are they? Have you done these things? Pay attention to these things, be aware that they exist, and be better prepared. Be nice to your future self if you want to write for this grant, and start thinking about all of these things and doing this work now. This is our contact information. Again, I'm going to bounce out a little bit, and I'm going to share a couple things with you, and then just kind of like in the last minute show you a couple things. The slide right here that has these links goes to the previous notice of funding opportunity, so you can look at the package online. So if you click this link, you can go to the package right here, and you can look at the package under this view, and you can actually download the instructions. You can look at all of the attachment forms. You can do all of that actually online. Again, this is last year's. This year's is not available quite yet. But you can actually go look at this. You can go look at what a notice of funding opportunity looks like. How is it written? All of those things, right? Another thing, I'm going to share this link in the chat. Melissa had mentioned this concept of making sure that you don't have overlapping zip codes. There is like an interactive map for you to see what other DFC coalitions exist. So that's kind of a cool little thing. To just know that that's available for you to see. Other than that, there's also tons of information on the DFC website with the CDC. This is actually the risk questionnaire, this is the risk questionnaire from the CDC. So like you can see that this form already exists. So you can have a fiscal agency already take a look at this for you and maybe even have this already prepared. This is just a publicly available report. And then this is a link to the budget preparation guidelines, just a PDF directly of what those are, so you can kind of get familiar with some of the format, different things like that. And yeah, anyway, I know that was like so much information. It was crazy. And again, so Taylor put another link in the chat. Make sure that you sign in, get attendance for the day. And I'm gonna go really quick. I'm gonna go put all these in the chat really quick. If you want to stay on, I'm willing to stay on for a minute and answer some questions while I get some of this stuff uploaded. Thanks for listening to us. And sorry for overwhelming you likely today if you're planning on writing for this grant, but just know we're here as a support. So.
Did anybody have any questions? One of the questions that like Maddie had mentioned, is anybody interested in getting together in person for like a day or two to actually go in more detail and kind of have some little bit of hands-on work? Is that even an interest or no at all? I always have people reach out to me every year for help, and I don't mind. What I say is I won't write the grant for you, but I can help guide you through it and do the best that I can to help ease the pain. And like Maddie said, the stuff usually when I'm working with my staff, what we've presented is usually like a day-long thing, but then also there's follow-ups where we're working together and showing them all kinds of things throughout the whole month, and the application comes out. And so I don't know if anybody's even interested in that at all. But if we don't, you're always welcome to contact us. But if there's a huge interest, then maybe we can look at trying to get together somewhere. Probably up north is probably the best location centrally, where we can get together and kind of have a more hands-on, be able to ask more questions in detail. You've got the application, I've got this, now what? Now where do I go? And kind of learn from each other. But anyways.
Awesome. Thank you, gals, so much. Does anyone have any questions for Maddie or Melissa? Okay,
looks like we just
out...
overwhelmed everybody. But
there's a lot of information.
It was. I did make sure. So if you want to, and maybe we can see, I don't know, Taylor, if some of the files might be a little bit too big, but we can see if maybe some of the files can be shared with the membership with the recording. But just a PDF of our slide deck today, and then some helpful files that we promised we'd share that are not as friendly on just like webinar slides. And then I did put that link if you're interested in figuring out, honestly, if you just Google a lot of these things like drug-free communities coalitions, or like whatever you want to, there's a lot of things you can just Google and they pop up for you. But anyway, those are the things I shared in the chat, is the link to where you can find what other DFC coalitions are in the state, and then those 2 files that we created that we were willing to share with you. So
awesome. Thank you, gals, so much. Does anybody have anything else they'd like to share? Oh, Lisa?
So I just wanted to announce that I am taking an early retirement. So I'll be leaving Kane County, and put the word out there that there will be a position. I don't know the details of what that'll look like in the future. Melissa would be your go-to person if anyone's interested or knows anybody who's interested in being down in Kanab. And what I have found over the past year doing coalition work is it really does need to be somebody who's embedded in the community to maintain those connections, and not being able to move here like I had planned has really been an obstacle to making those community contacts on a regular basis. So get with Melissa if you're interested, or just watch for a posting, I guess. I don't know how it's going to work, but I'll be leaving in January. So there's another month that I'll be here.
Oh, we're gonna miss you so much, Lisa.
Thank you, guys. I've enjoyed the part that I've played, and now it's time to hand the baton off in the relay.
Awesome. Thank you for sharing. Does anybody else have anything? All right. We'll make sure to send out all this information, the slides, the recording, and everything in the next few days. But thank you so much to everyone for tuning in. And gosh, we won't see you before the holidays. So have a wonderful holiday season and stay warm and stay well. Thanks everyone. Thank you, Maddie and Melissa and Shannon. Have a great day.